Good evening, ladies. I sure hope you've been enjoying the holiday season with your family and your friends, and that you've had a good week so far. And well, welcome to Wellness Wednesday. I have a topic here I think that will be applicable to many. Just making sure everything's working. Thumbs up if you can hear me and see me okay. Everybody see me and hear me okay? Yeah, all right. Thank you. Great. Awesome. So good to be with you again. And let's just get into things. I'm going to say my disclaimer that I need to say with everything that I normally would. And as we do these live presentations. So, all right. Anything I say tonight on this public forum is just health information. It is not specific health advice. Please do not stop taking or start taking or change the way you're taking any of your medications. And if you feel strongly that you should, please contact your prescribing practitioner first so that they can help you make those adjustments appropriately. And attending this Wellness Wednesday, unfortunately, does not establish a doctor-patient relationship. Okay. I want to tell you, before I get into my topic, you've probably all heard of it, but some of you ladies are new maybe, and I want to get it out there to everyone, especially the new ladies, that I do a Wellness Wednesday every week as much as I can. And I am excited to announce the master class that will be held in just over a couple weeks, January 15th through the 19th. And I will be meeting right here on the Facebook group every evening at 8 p.m. Mountain, 7 Pacific, 9 Central, 10 Eastern, so all these time zones. And it'll be, again, every evening. And it may go into the weekend too, because I do have a lot of content that I hope to share with you. And so that is, please look for the registration. It will be in the comments all over the group page, and get registered for that. You will attend it just like you're doing now with these Wellness Wednesdays, right inside the Facebook group. So I will be sharing life-changing information during that class. Life-changing because so many of you are dealing with labs that are normal, but you still don't feel good. In fact, some of you feel downright awful. And yet your tests, the basic tests that you get, are all normal. Some of you have been led to believe, or maybe you've just, I don't know, maybe I hope you really haven't internalized it so much, but you've learned that it's all your fault, that it's something you're doing wrong. I want to tell you that it's not all in your head. You're not crazy, and I will explain why. It's really helpful, I think, to gain the right knowledge. There's a lot of information out there. So one thing I'll be doing is I will be dispelling so many myths about the weight loss industry, the dieting industry, right? We're going to get into that. We're going to get into the blueprint, my thyroid repair blueprint, that has helped thousands of ladies get on the path toward fixing their thyroid and changing their lives. So you don't want to miss it. It's just going to be awesome. So, okay, I am talking today about thyroid removal. So jumping right into the topic, thyroid removal, because it is a topic that I wish I could spend more time in during the class, but because it doesn't apply to everybody, it's very important. And it may speak to those of you who have had, even if you haven't had your thyroid removed, maybe you've had discussions with doctors about getting your thyroid gland out. Um, maybe you know someone who has had their thyroid gland removed, or treated in some way. We'll get into that. And they're still doing very poorly. So yeah, let's dive in. So thyroid removal has several implications. Okay, I need you to understand that, and it creates problems that doctors are not equipped to handle very well. Even specialists, endocrinologists, it's almost similar to getting your gallbladder removed. You know, maybe some of you who have had that, you were told that, oh, it won't matter at all. You can do without your gallbladder, and that might be true enough, but I'm sorry, but almost every woman that I know who's had their gallbladder removed still has several issues, sometimes major issues with their health. And it almost seems like it starts a downward spiral. So I've never felt good about just blanketly, I shouldn't say that. Never felt good about the frequency of gallbladder removals, how frequently this happens. I know there's a time and a place for it. I'm not that, I'm smart enough to know that, and to think and believe that it is necessary sometimes. I was involved in some of those surgeries. I've seen massive gallstones removed, terribly sick gallbladders removed. There comes a point where there's a point of no return. So I understand that sometimes it has to happen, but let's talk about thyroid. Does this happen with your thyroid? Now, rarely, yes, the thyroid gets sick with cancer enough that it has to be removed. Sometimes it gets so large with nodules and with thyroid tumors, not necessarily cancers, but tumors that block your airway, little by little, block your ability to swallow, because it's right here. It's like right, it can press against those structures. And so it's important to know that, there is a time and a place for that. But let's talk about reasons why thyroid needs to be removed, or is, let's say, why it is removed, whether it needs to or not. So, all right, thyroid cancer. This is a big deal, and I've done a whole Wellness Wednesday. Well, not a whole Wellness Wednesday, but a previous Wellness Wednesday on the types of thyroid cancers and those implications. And I'm not going to get into that tonight, but you might want to go back to the Wellness Wednesdays and review that after this one. Just if this something that is something you're dealing with, or is something that someone else is. Okay. So thyroid cancers, the main treatment is thyroidectomy. And whether it's removing half your thyroid or the whole thing, maybe it's just a lobe that's being removed. Maybe it's both lobes and the isthmus, or the connection between the two lobes of your thyroid. And it just depends on what's involved where they decide to remove it. I've seen cases where they've just blanketly removed the whole thing because of cancer and part of it. And sometimes they've left, on the other hand, sometimes they've left half of the thyroid. So thyroid cancer, one of the reasons for thyroid removal. Hyperthyroidism, whether it's due to Hashimoto's or Graves' disease. Okay, because Hashimoto's does often start out with hyperthyroidism. And I'm going to get into more of this in the, I'm going to get into this in the master class as well. So you'll be reminded, but hyperthyroid can be deadly. So that condition where you've got too much active thyroid hormone, largely because you've got too much thyroglobulin carrying too much thyroid hormone and releasing it throughout the body, can be deadly. Okay. Those of you who have researched and know about thyroid storm is what I'm talking about. And some of those symptoms include shaking, tremors, twitches, muscle twitches, heat, feeling hot all over all the time. Not just hot, not hot flashes, but all the time. Rapid weight loss, so rapid fat release and weight loss, because that's one of the purposes of thyroid hormone. Then there's anxiety, sleeplessness, really bad insomnia can be caused by hyperthyroidism, and just a real feeling of unease and like you just can't be calmed down. Sometimes a kind of a buzzing sensation happens. Graves is a condition, an autoimmune condition that causes this, all right, that causes one of the signs and symptoms is called exophthalmos, where your eyes kind of bug out because of contractions of the muscles in the eyes because of the excess hormone. So you've got those kinds of things. Graves, once again, is an autoimmune condition causing the symptoms where you have antibodies acting on specific receptors in the thyroid to speed up this, this production, thyroid production, and causing hyperthyroidism. Hashimoto's, like I said, can start out this way. It can really be similar. And I've known many, many patients over the years, over my 18 years of practice plus, who have started out with this kind of symptomatology, and they've actually come to find out had Hashimoto's rather than Graves. It's a difference in testing and what's positive in the testing. So hyperthyroidism is a reason why the thyroid is removed or treated, at least. We're going to go through that. So goiters or nodules, multiple nodules, most often, usually when there is swallowing or airway compromise is when they would remove a thyroid based on having a goiter or nodules that for some reason nothing else was tried. I've even known that to be the case where, goiters can simply be an iodine deficiency, and you need iodine to help thyroid function. Thyroid hormone is, in fact, made of iodine and 2 tyrosine amino acids. It's crazy that we're hearing all of this bad stuff about iodine. Like, your body absolutely needs it. Now, it may have enough to go around. It may not need more, but your body needs iodine to be able to make and recycle thyroid hormone. It's just what it has to have. So move that over just a bit so I can see some of the comments. Okay, and then let's talk about traditional treatment for this. So thyroid can be removed or it can be treated with, you probably know about this. It can be treated with radioactive thyroid ablation. So radioactive iodine is introduced, and then this causes an ablation, causes the thyroid to die. Okay. And so here's the thing about treatment. Levothyroxine is the mainstay of thyroid hormone replacement treatment after the thyroid gland has been removed or treated with, radioactive iodine treatment, or obviously chemotherapy, or uh, you know, radiation can also kill the part of the thyroid if they want to use that. It just isn't a common that common of a treatment nowadays. So levothyroxine replaces the hormone that missing thyroid gland would make. Okay, so let's talk about this. The thyroid gland produces not just it doesn't just produce T4 or levothyroxine. Levothyroxine is the type of replacement. It's similar to thyroxine, which is T4. Okay. And so because the thyroid gland also produces thyroglobulin, which carries T4 and T3 and T1, T2, T7. All right. Calcitonin is another thing. I'll get into that in a moment. Because the thyroid hormone produces all these and produces this carrier, thyroglobulin carrier, what happens when you don't have a thyroid gland? It's not making those other things. It's not making thyroglobulin to help carry and deliver thyroid hormone to your body. So those of you who have had your thyroid removed or treated similarly to kill it, aren't having much luck with levothyroxine because you're not making extra carrier, right? You're not making that thyroglobulin. That there's no treatment for that, ladies. There's no treatment to replace necessarily, there's no drug treatment to replace thyroglobulin. There's no drug treatment to replace T1, T2, T7, which are other components used to make T4 and T3 the most metabolically active thyroid hormones. So it's an incomplete treatment. Okay, calcitonin is another hormone that your thyroid gland makes, but if your thyroid gland is removed or radiated, irradiated is the proper term, then that opposition to parathyroid hormone, which mobilizes calcium into the blood, calcitonin opposes that to keep calcium from collecting in the blood. It maintains balance there, maintains balance with bone health. So thyroxine is an incomplete treatment. Removing the thyroid gland is going to lead to further health consequences due to inadequate thyroid hormone function, and certainly calcitonin function is gone now. Now, this leads to insulin resistance. That's a whole different topic for another day. It leads to hormone imbalances. It leads to organ dysfunction, which is often a very insidious or slow degenerative process that goes unnoticed by traditional testing methods. So think about this for a moment. Imagine every cell in your body like this little balloon, and it has little receptors that from inside the balloon coming to the surface and poking out. You don't pop it, don't worry. Poking out to accept hormones that come in and bind. So there's insulin, there's estrogen, there's progesterone, there's testosterone, there's, you name it, whatever that hormone is, it needs a receptor. And without thyroid hormone to turn it on, those organs begin to, those cells become dysfunctional. Then the organs become dysfunctional little by little. So insulin resistance happens because the cells can't put receptors out for insulin to help those cells get glucose inside. That becomes a problem. That leads to diabetes, right? And it leads to so many complications, so many health complications that hit you from head to toe, literally, because everything's impacted. Every part of the body, every cell in the body is affected by thyroid hormone. So the organs that are affected the most: adrenal glands, the GI system, your gastrointestinal system, your cognition, your brain. This leads to cognitive decline, even strokes, and decreased melatonin, so you get poor sleep. Calcium, when calcium's too high in the blood and it's getting deposited, because you're missing calcitonin from an absent thyroid. Do you see where I'm going with it? There's a domino effect that's significant. So then you stop making melatonin, and you don't sleep through the night. You wake up, right? And so then you don't feel rested, and then you don't have energy. Gastrointestinal dysfunction. This can lead to constipation. This can lead to IBS. I did a Wellness Wednesday on IBS last week. This can lead to poor absorption and so many other GI problems, including autoimmune dysfunction. So this can lead to heart disease and dysfunction, heart failure. It can lead to heart disease and dysfunction in terms of, so even coronary dysfunction, so heart attacks. It can lead to bone disorders, osteoporosis. It can even lead to blood cancers, because when the marrow isn't getting the right signals from the thyroid, those cells also, and your body's, it's like, we need this, we need that, we need it now. So it may not be getting the right signals, and so it's going to do what it wants. Okay, so that's how these, blood dyscrasias and blood cancers, like leukemias and lymphomas, start. And there are other factors. You realize that I'm skimming the surface, otherwise we'd be in, medical school here. Liver dysfunction, fatty liver is even caused by a lack of thyroid hormone response or hormone influence in the liver. Okay. So if you don't break down the fat, which thyroid hormone instigates, then your liver becomes more fatty. All right. So we're going to get into some testing considerations here. Why is it then, if you don't have a thyroid, think about this. If TSH is supposed to stimulate the thyroid, which is what it stands for, thyroid stimulating hormone, where does it land? It tells the thyroid what to do. This TSH is supposed to tell the thyroid what to do. But if there's no thyroid there to make thyroid hormone, where does that land? So what happens without a gland there? Right? What does the TSH act upon if there's nothing there to be acted on? So why in the world would doctors only want to watch TSH? It's in this scenario, it's practically useless. Now, I'm going to give you a little bit of a caveat, and this is why the right testing is so important. When they remove a thyroid gland surgically, they're not removing every single cell. There are 4 tiny glands called the parathyroid glands that sit right in the back of the thyroid. And if you remove everything, you remove the parathyroid glands because they're tiny. So they don't remove all of the thyroid tissue, 100% of it. They leave a small portion of it, okay, with the blood supply to the parathyroid glands. Now, this is crazy, but those few thyroid cells and that little bit of a thyroid tissue around those parathyroid glands may produce a lot of hormone for you, may produce some hormone, some thyroid hormone and thyroglobulin. And so we better test that. We better test these other tests. We better, even if you've had your thyroid removed, we better test T4 and free T4, T3 and free T3. We better check reverse T3. So I will be going over all of these other tests during the masterclass. You simply don't want to miss that, because going through what these tests mean is so important. So if you've had the thyroid gland is removed, there's going to be a little bit left. And I have an interesting patient story to share afterwards, but there are several other thyroid markers that doctors simply do not test. And this is where comprehensive testing is the only natural next step to find out what's going on. And then you've got to have a doctor who knows how to put it all together and give you a comprehensive diagnosis based on your areas of dysfunction. So there are other tests that need to be looked at. Okay, now let's talk about hormone replacement and what might be a better treatment than levothyroxine for those of you who've had your thyroid gland removed. And again, you need someone who understands why this is better, and then understands how to put it together with the other organs that are dysfunctional that are also impacting the way your thyroid works. Now, some of these other treatments include natural desiccated thyroid. And some of you, I'm sure many of you are aware of the other brands out there like Armor Thyroid, NP Thyroid, Nature Thyroid, things like this, where it's a little different than T4 or levothyroxine or Synthroid or brand names like Euthrox and things like that. But there's also prescription T3 and so forth. There's also this desiccated thyroid that extracts T4 and T3 and put that in a pill. And so it's also missing some other components of thyroid tissue. These are also made with gluten and dairy type fillers, including lactose and other things, and binders to keep those little tablets together. And another problem with these is they're often on recall status, back order. There's an inconsistent supply with this, but they do often work better because they're a more complete thyroid. Now, natural desiccated thyroid in other forms, okay, have more of these other components in them. So it'll have your thyroglobulin component. It'll have your T1, T2, and T7 components. And so those are important to have so that you can make the proper thyroid hormone even when you don't have a thyroid gland. Okay, so interesting, right? Hashimoto's and Graves. I need to talk a little bit more about that and just say that Hashimoto's is much more common than Graves. So if you've had your thyroid out because of hyperthyroidism, because of Graves, it could very well have been Hashimoto's instead. Both of these are autoimmune conditions. They are both caused by immune system triggers or made worse by immune system triggers. So we have to find those triggers. and doing the right tests will test for those triggers, right? So removing the thyroid gland does not cure the autoimmune issue that underlays this. All right. I'm gonna show you in the masterclass how to find what the triggers. I'm going to talk about finding the root causes of this, because you can't cure or solve or fix the autoimmune issue. Once your immune system is prone to making these antibodies, it's very unlikely it won't stop all the way. Getting your antibody levels down is often an unrealistic goal of treatment, and so almost none of my patients. There are a few who we see it happen to. Don't get me wrong, where they're able to get their antibodies down very low to less than normal, less than what the positive tests show. Oh, did you see that? Did you see that confetti? Awesome. I don't know why that happened. Maybe we can try it again. Guess not. And so we're able to find the root causes, but and knock those down as much as possible. But we can only bring these autoimmune conditions into remission. And yes, we should at all costs try to bring these into remission. Because even without your thyroid, there are still these autoimmune forces acting on your thyroid hormone and the effects of thyroid hormone. So the other thing that I want to be sure to mention is that you either have the autoimmune condition or you don't. So we're gonna get into that more during the master class as well. All right. You cannot have both hypothyroidism and hyperthyroidism at the same time. Okay, it's got to be one or the other. And so if your condition truly is hypothyroidism because of your symptoms, the obvious symptoms of hypothyroidism, then to have your doctor look at your labs and tell you that your low TSH means that you have hyperthyroidism is flat out false. It can't happen. All right. Those two conditions cannot coexist at the same time. Now you can kind of swap from one to another. Yes, that's possible, but you cannot have them both at the same time. So when is thyroid removal okay? I kind of touched on that before, but honestly, ladies, it is a very individual matter. You must weigh the risks and benefits, and this depends on your actual situation. You need to have a doctor who knows this stuff and is willing to spend the time with you to help you sort this out, to weigh the pros and cons. Is it really impacting your ability to swallow? Is it impacting your breathing ability? So once again, the methods to remove your thyroid would include radioactive iodine ablation, surgery, but keep in mind, these are not always complete removals or complete, tissue destruction based on these ablations. It's important that we realize that nothing is 100% in with the body. All right. There's always factors that can be overlooked. And so what I try to do is really look for the root causes, everything that we can find, treat those and allow the body to heal itself. Whether or not you have a thyroid or not. All right. Now I'm going to give you a couple of patient examples. These are kind of fun and interesting. Bernadette she became my patient years ago before I started practicing functional medicine. She was 40 years post total thyroidectomy. She told me that she was taking, sorry, that she was not taking anything, that she had had her whole thyroid removed 40 years and had never been put on thyroid hormone replacement. Isn't that nuts? And to top it off, the test that I ran at the time, I remember running a TSH, a T4, and a T3, and they were within normal limits. And again, that was based on my limited understanding at the time. I couldn't, it was so odd to me that I'd come across a patient like her. And I said, well, I've never seen this before. And so I thought so much about this. And over the years, I ultimately came to the conclusion that she must still have thyroid tissue. And I since realized that, oh yeah, well, she had her parathyroids, and we had tested some of that too because of some elevated calcium in her blood. So we had to check parathyroid hormone. Well, she must have had some thyroid tissue that was enough to keep her from having a whole lot of symptoms, because she really wasn't complaining of that many symptoms. All right. So, and I have had, I'm just going to say, looking at the time, and I want to get to some of your questions. I've had several other patients since with complete thyroidectomies, many with Hashimoto's still, like the antibodies are still there. They're clearly, the immune system is clearly upset about the way some things look, and so they're still making thyroid antibodies, and I'm happy to say that these patients almost without exception are doing much better since going through the thyroid repair blueprint that I talked about earlier, and being able to find their root causes. So, more energy, able to lose weight and keep it off, better brain function, less brain fog and trouble, cognitively. If you've had your thyroid removed, you still should have hope. All right. Even if you're not feeling well right now, you should still have hope. All right, ladies, I'm going to get to some of your questions, and it'll just take me a minute to scroll through. I know some of my awesome staff were marking some of those for me. Okay, so the first one is, which thyroid medicine is the best when the TSH is high and T4 is low? And again, this gets into the nuances, Nara, and thanks for asking the question. The nuances of how thyroid works in your body. You really do want to tune in to the masterclass, because I will go through all how that mechanism looks. I will go through how you have to look at other organs for how T4 is converted, right? T4 has to be converted. The thyroid hormone certainly does make mostly T4, but it has to be converted in certain tissues and organs. And if those organs are not functioning properly, then you have to have some help to fix them. And then the levothyroxine or T4 might work better for you. If you have low T4, it can be because you're also producing too much reverse T3. T4 is converting instead to reverse T3. So that's got to be checked. So it really, I can't even tell you what the best medication is with the little information that you give me in your question. So understand that is very individual, that you deserve a comprehensive look, comprehensive investigation into why you may be having the trouble you're having. Let's see. That was a good question. Takes me just a minute because I have a lot of comments to go through or to scroll through. Next question. So Tracy says, my doctor has not put me on any meds for my Hashimoto's. Okay. And again, this is really sad because, and she says, do you mind, hope you don't mind me, Tracy, saying that you've got hair loss and you're just losing it in handfuls. So I'm so sorry for this, but your doctors aren't paying attention to your symptoms, all right? And they're probably only paying attention to the TSH, which can be normal with Hashimoto's. Hashimoto's actually can cause the TSH to remain normal. So it doesn't look like you need any thyroid replacement based on just the TSH. Unfortunately, that's not the only test you need. And like, that's not what they're not trying to find. They're not trying to find help. They're not trying to find reasons for your symptoms. And there is no, magic medicine for hair loss like this. So this is something so many suffer from, and yet you need further evaluation, a comprehensive evaluation. Another question: why are so many people having thyroid issues these days? I truly believe that it's because of all the toxins that we're exposed to more and more and more. And we're also we're dealing with a lot of chemicals in our environment, so much more than our grandmothers and great-grandmothers were. Now, some of you have significant family histories of thyroid issues and Hashimoto's and so forth, but the food we eat, the air we breathe, the water we drink, our water's full of iodine suppressors, fluoride, chlorine, bromine, which lead to autoimmunity and Hashimoto's, frankly. That's one of the causes. I think that's the reason. We're exposed to so much more, and stress. I know our predecessors, our ancestors had stress. We live in a rat race, though. Like, we're constantly being bombarded with stimulation. I mean, even here on Facebook, you're just constantly being bombarded with information, and while information is good, just being exposed all the time to the stress, to the stimulation, sometimes is not so good. So only visit the group and don't do anything else on Facebook. No, I'm just kidding. But you see my point. Like, we're living in a time of so much more stress. Okay, stress on our bodies, so many more surgeries. Surgeries are stressors, by the way. Okay. Next question. The The doctor who did my parathyroid said I had hypoparathyroidism and allergic to iodine, not to use iodized salts, only plain salts. So your terminology isn't quite right. If they said parathyroid and then made a reference to iodine, that's probably not right. And then hypothyroidism, you're not allergic to iodine. You may be sensitive to having more iodine, and that can really throw you off. So you don't need any more. You've got enough, or it could be that you react to the radioactive form of iodine, and that can be in. I mean, you can have some really bad forms of iodine floating around out there. I do have a patient who, or had a patient who was very, very sensitive to it, and in her case, she just didn't need more. She had enough to, and then with what she was, getting, because when you're given, this is what's interesting, when you're given levothyroxine, there's iodine in that, because levothyroxine it has 4 iodines per molecule of levothyroxine. That's what the 4 means, 4 iodines. So you're not truly like allergic to it, but doctors have no other explanation for this, and it gets really sticky, and you're probably going to go away from tonight really confused, and so I'm sorry about that, but it's an element in that we all need, that makes us who we are, that we all have to have thyroid hormone to function, and thyroid hormone is made of iodine, period. Okay, there's no I don't know what else to say. All right. But iodized salt are the bad forms of iodine. Okay. So in that sense, they're right. Okay. Next one. I'm 56 now, but had a hysterectomy at 27 years old. Is that the reason I was diagnosed with Hashimoto's? I cannot afford to lose any more hair. Oh boy, that's tough. No, I don't necessarily think that the hysterectomy itself, when your supply of estrogen and progesterone was cut off, literally, that it's tough to say whether that would be the cause of Hashimoto's. But there are so many other things that can cause Hashimoto's. Most of those things relate to things that we consume, and so it starts in the gut. Okay. Next question. I have Hashimoto's and have extremely high antibodies, 2,800. Should they try to be lowered? If so, how? Okay. So like I said before, the goal of treatment isn't necessarily, the realistic goal of treatment isn't necessarily to reduce your antibodies to 0. It won't happen. In fact, even getting the right treatment where you're getting to the root causes of this might cause them to go up, and that's okay. It's just, there's so much more to the story and to how you should be treated than just focusing on lowering your thyroid antibodies. Next question. So, and that's good, and that's the best I really should could do right now without having more context about you and about without comprehensive testing. Honestly, I can't really go further. Okay, I've been diagnosed with a large goiter that they want to remove, including my thyroid. It's so large, it's impacting my trachea. Are there other alternatives to removing it? Is there something I could do that would shrink it? Okay. So this is what I was saying. This is very, very individualized. please watch the masterclass and take the opportunity maybe to get testing done, because it's and I would just need to have more information. I would need to have much more information to answer that question, especially in this public forum. But because it is impacting your trachea, it could be good reason to get at least the goiter part, the large nodule that they call a goiter, removed. But please don't go home from tonight saying the Dr. Ed told me I should get this removed. Do not do that. It's you really should potentially meet with me first, and then we could discuss the nuances, all the pros and cons of that decision, because I think it's a major decision. And yes, I have many patients, for those of you with thyroid nodules, that have their have had the nodules shrink with the right approach, with this, through this thyroid blueprint that I'll be describing in great detail during the masterclass. So there you have it. Oh, there's the thumbs up. All right. I guess we should take that for a sign that that's all for tonight, ladies. And so I hope that this information has been helpful. It is such a pertinent topic, and I'm glad that we had an opportunity to get to it, because taking the time during the masterclass to go through this would not let me share other very important information that I need to share with you during that time. So there you have it. I think I'm going to sign off. Again, don't forget, put it on your calendars, put a reminder in your phone for 5 minutes, 10 minutes, before the event kicks off Monday, January 15th, right, at 8 p.m. Mountain Time, 7 Pacific, so that you don't miss anything. And we'll jump right in then and learn all things thyroid that you need to know to reverse the low thyroid symptoms you're dealing with, and other symptoms that you may not even recognize, or maybe they are part of your thyroid problem. Maybe they're not. Maybe there's something else going on, but we need to find out. Right? Now, have hope there, and come to the class. There are answers, ladies, and you still have the power to heal. Thank you so much for attending tonight with me, and have a wonderful evening, and I'll see you soon.